Good morning, everybody, and welcome to this webinar on vaccination for agency social care workers. And I'm extremely pleased to be chairing this meeting. My name is David Pearson, and I have been the chair of the government's COVID-19 social care task force, which met in 2020 and then continued to support the government for the following 9 months in order to support the implementation, and had quite a bit to do with the winter plans that had been developed for the sector. And then more latterly was asked to come back into government to support the response to Omicron, and since the beginning of January have been chairing a vaccination boosters task force for social care. And we wanted to have this webinar, invite you to it, to talk about the importance of COVID-19 vaccination and boosters for agency workers working in adult social care, to improve communication with you, because we think that communication is the key so that we can understand the agenda, understand concerns and address them. And that's one of the primary purposes of this agenda. I'm delighted to be joined by Dr. Adrian Hayter, who is a GP partner with Runnymede Medical Practice, and he's also the National Clinical Director for Older People and Integrated Person-Centred Care with NHS England and NHS Improvement, and also Yerin Seo, who is the Senior Campaigns Manager working at Recruitment and Employment Confederation, with a focus on health and social care agencies. And I'm also going to talk about, a bit later, a little section on the importance of data and information and why that's so significant. And then after that, we're going to have a question and answer session with the time we've got left. So please do think about your questions and do put them in the question box, which, if your screen is the same as mine, is in the top of the screen, and it's got a little question mark on it with a couple of bubbles, and you can put your questions in there and we'll do our best to answer them. If we don't have the opportunity to answer all of them, which is highly likely, we'll take them away and circulate some answers to questions that are unanswered in themes, probably at the end of the after the webinar. So without further ado, I'm going to introduce Dr. Adrian Hayter to talk about stuff. But before I do that, I just wanted to acknowledge a couple of announcements that are significant and you may have been wondering about. The first is that we've got JCVI, the Joint Committee on Vaccination and Immunisation, which is the body that advises government on when it is appropriate to vaccinate people, have recently given some advice, which has been in the press, on second booster doses to be offered to older adults over the age of 75 and those over to 12 who are immunosuppressed. So clearly that will have an impact on the social care sector, particularly those over the age of 75, and many people who receive social care services who are immunosuppressed. The other thing to say is, subject to advice of JCVI, further vaccinations may be recommended for people who are most vulnerable to serious outcomes from COVID-19 this autumn, and potentially those people who care and support them, so potentially the staff in health and care. And I think it's very important that we have that in our minds in terms of our psychological and practical preparation for what is likely to be eventuality. My experience in working on vaccination as part of the task force, and I was heavily involved in the prep for the sector in the first 2 doses back in the early part of last year, is that having a run at this with people thinking about it and talking about it with staff is absolutely crucial, and the evidence from the task force that I've been sharing absolutely reinforces that. We also have, by way of communication, and in order to help with that, we also have a regular adult social care weekly newsletter, which you can sign up through the department's website, and so you can receive that information. I think the other thing, by way of announcements, is that obviously the policy on vaccination as a condition of deployment, which was implemented for care homes last year, has changed, and there has been a consultation on revoking those arrangements and not proceeding with them for the NHS and the rest of social care sector. And that's because of the issues around Omicron and it being the dominant variant, and the scientific evidence not quite justifying making that an absolute requirement at this point. But of course, that doesn't mean to say that vaccination isn't terribly important. It probably remains. I had a meeting with the chair of the SAGE working group, the scientific advisory body, who with a specialist interest in social care, who reinforced to me this week in writing the importance of vaccination as the first line of defence. And the fact that we end up in a much better position than we were, say, this time last year is not only to do with the nature of Omicron as a variant that has more transmissibility, but to a degree less impact. We are still talking about a very dangerous disease where we had 3 variants last year, 2 of which were worse than the original Wuhan one of which was slightly less impactful, but we are still dealing with a dangerous disease, particularly in areas where people are looking after people who have perhaps through old age or suppressants issues are vulnerable. So it is still nevertheless extremely important that as many people in social care, working social care, get vaccinated as possible. And in a way, the more that we come to move around and mix with other people, with each other in a way which is fantastic, isn't it much better than we've experienced in the last 2 years? That's terrific, but that means that it still will circulate around the community. We will still get it, and we could, and if you are not vaccinated, the evidence, which I'm sure Adrian will talk about, is that you can still become very seriously ill. And you can, you're more likely to pass it on in substantial measure to people around you. I think that's whilst VCOD and the vaccination condition of deployment and the issues in relation to vaccination in the future isn't the primary purpose of this webinar, I thought it was an extremely important context, and therefore I wanted to address those issues. So back to the main purpose of the webinar, which is I'd like to introduce Dr. Adrian Hayter to take us through the whole issue of the importance of vaccination in protecting staff and people with support needs. Adrian, over to you.
Thank you very much, David, and thanks for that introduction. I'm a GP and the National Clinical Director for Older People and Integrated Person-Centred Care at NHS England, but really have been supporting the work of the vaccination programme for the non-age-based cohorts of our population. And it's incredible because that vaccination programme has only really been in existence for 14 or 15 months, and we've been vaccinating our population across England with great effort. I think it's often said that the NHS's efforts to vaccinate the population have been really fantastic, but actually the NHS has not done it on its own. It's actually done it with its communities, with general practice, with its primary, with the communities around the general practices, with professionals, with people in the social care sector. And the more that I've been involved over this last year or so, I've appreciated that this is really a collaborative effort. I just wanted to, emphasise from David's introduction, we've now given nearly 170 million doses of the COVID vaccine, and our population so far, 31 million have been given booster or third doses of the vaccine, and of the eligible populations over the age of 16, 82% have been vaccinated. So this is a massive success in terms of people being vaccinated. On the other side of that, we know that this current wave of Omicron is on a downward trend. However, this is a very serious condition. We have currently around 8,000 to 9,000 people in hospital with COVID, and we have about 300 or 400 people in ITU across the country with COVID, and it's a very serious condition and a very serious illness, and it's important that we protect ourselves so that we can deliver good care, but it's also important that we protect the people that we are giving the care to. And in that sense, we are here to support and encourage as many people as possible, really, to when they're invited to come and get the vaccine. I work sometimes in the vaccination centre in Windsor, and the vaccination programme has got lots of different ways of supporting and delivering the vaccination programme. On the slide, you can see the various delivery models with over 300 fixed sites. But as well as those fixed sites, there have been vaccination teams who have been going out into the communities, whether it's on a bus, a taxi, at a shopping centre, at a sheltered care accommodation site, or whether it's in nursing or care homes. The teams have been going out into the communities, and this has been one of the reasons why the success has been so quick in terms of getting people vaccinated. That being said, there are still people who haven't had their first dose of vaccine or their second dose of vaccine or their booster. And when I work in the vaccination centre, I see those people. It's an evergreen offer, and it's great to have people who come for the first time for their vaccine, and the staff in these vaccine centres, in community pharmacists and GP practices, in the hospital sites, are really used to supporting people in understanding about the vaccine, understanding the what the side effects are, how easy it is to have the vaccine, how safe it is to have the vaccine, and answering questions that people might have, whether that's around pregnancy or fertility, or whether it's around their individual circumstances. The staff in the vaccination centres are there to support people with that. They're not just there to do the vaccine delivery. So really kind of from the perspective of home care and care staff, this working with the care managers is so important, because we have to be able to identify the staff that work in people's homes. As a GP, many of my patients have really important carers who rely on that care to be able to live, and it can be the difference between life and death for a lot of people, and a lot of those people are vulnerable. They need that support, and I've been amazed through the pandemic around the lengths that some of the domiciliary care staff go to be able to support the residents that they look after. Some really great examples of that. I've also been amazed around the care managers, the managers who support those staff, and I have had conversations with those care managers who understand the needs of their staff as well as the people that they look after, and are able to support the filling in of the capacity tracker so that we know who's been vaccinated in terms of staff, who are able to support questions. And the vaccination teams will try and connect to those care managers to be able to make make it as easy as possible for the staff to be able to get vaccinated, and whether that's in a sheltered accommodation unit or whether it's in a CQC registered care home, the vaccination teams are there to rove out, and we call it roving, when people are going out with all the equipment that's needed to be able to vaccinate. And it's something that needs to be prepared. It's kind of not easy just to do that without the preparation. So the teams are there being prepared to be able to deliver the vaccine. I think we've got one more slide which we could go on to, Sarah, if that's okay. I think just and this is just to highlight the routes which are available for booking your vaccine. You can go onto the online booking system, you can call 119, you can walk into vaccination sites. As a carer, you have priority, you have a fast track to get into that site, and they will vaccinate you, take you through the vaccination process. You can actually, you will also possibly receive an invitation, and some of that is now being done in GP surgery, so it's really local to you, or you can pop into a vaccination pop-up clinic. There's a vaccination pop-up clinic which is in my area, which has been going around different sites, shopping centres in Slough, as well as places around the Windsor area. And then vaccination roving teams, as I suggested, are there to help support you and your staff to get vaccinated. We know that this is an effective booster. We know that it is saving lives, and we estimate that it's probably saved about 1 million hospitalizations for people with COVID so far. So please come and ask us the questions as health professionals around your own individual queries around vaccination. We're here to help. We're also here to guide you through that process and to get vaccinated as staff members to protect yourselves, your family, and also to protect the residents and the people that you're looking after. Thank you, David.
Thank you very much indeed, Adrian. Thank you for that. And we're now going to move on to Yerin Seo, who is, as I announced earlier, is the Senior Campaign Manager for the Recruitment Employment Confederation. And Yerin is going to give her reflections on the particular importance of this for agency workers. So, Yerin, welcome.
Yeah, thank you, David. Yeah, and thank you for the excellent promotion. My job title is actually Senior Campaigns Advisor. Yeah, and I'm from the REC, responsible for the health and social care sector. If Sarah could just go to the next slide, please. Yeah, just a quick running order of the next 10 minutes or so. You'll get to know a bit more about the REC, and I'll present some data about the sector, especially on the jobs market. And of course, yeah, I'll share our messaging on vaccines, and I'll also share some of the examples of initiative that agencies and workers can take towards vaccines hesitancy. Next slide, please. So the Recruitment and Employment Confederation is the trade body for the UK's recruitment industry. So as a whole sector, we place 1 million temporary workers into temporary or freelance assignments on any given day, every day, and another 1 million into permanent contracts every year. So that's the scale of the industry that we're serving. And in terms of scale of the membership, we have about over 3,000 recruitment businesses as our corporate members, and another, along with 11,000 individual recruiters as part of our membership. The REC is here to set and drive up the standards of the UK recruitment industry, and yeah, we provide a range of services to businesses. And being an REC member is a proud statement for businesses. And having our logo on your website or in your email signature demonstrates the professionalism and dedication of the business. One example from the healthcare sector is that when an agency bids for NHS workforce framework, one of the questions as part of the process is whether the business is part of a professional association such as REC. Next slide, please. Here just a short snapshot of the benefits of being an REC member. We really do bring a lot of benefits to businesses, your clients, and your candidates. Our legal helpline is quite popular. We also provide sector specialist support. So in terms of the healthcare sector, it's actually our biggest sector. We have almost 500 members operating in this space out of 3,000. So there's a lot of work and focus going into this area and this sector. We have quarterly healthcare sector meetings, industry information hubs, and the healthcare sector also gets, we put a bit of a focus in our research pieces or consultation responses, for example. Next slide, please. So just wanted to share some data from the REC regarding the sector. This is the data from our regular report called the Report on Jobs. It's actually quite well-known thing within the sector and often gets cited by the likes of the Bank of England as the lead indicator of the UK economy. So for February, as you can see, nursing, medical, and care came at the top of the rank in terms of the vacancy level, and the demand for temporary worker was particularly high. And although I could only fit 1 month data into this, we publish this every month. And looking at the trend in the last 6 months or so, the demand for a social care agency was really demonstrate the significance, the volume of labor shortages. Next slide, please. This is just another example of the market intelligence that we have access to. I just wanted to share some of these, and this also goes further to show how important it is for everyone involved in the sector to really work together and retain our staff, as well as to attract new recruits. And it's also important to build a bit of a framework to ensure we all can we can all ensure that no workers are leaving due to vaccine hesitancies. Next slide, please. So yes, finally into the messaging, REC messages on vaccines. I mean, from the day one, we've been quite consistent. Everyone who's eligible for vaccine should get fully vaccinated. They're here to protect you, your family, and your loved one, and they're also safe and effective. And they've been tested and evaluated by a range of organizations, likes of the WHO, of MHRA, of course, and other countries' regulatory bodies as well. And scientific evidence has shown over and over again that vaccines really do save lives. It reduces the risk of catching and spreading the virus, and it protects you from getting seriously sick or even dying from COVID. Next slide, please. So yes, everyone should get vaccinated, but it's even more important for social care sector. That's why care home residents and workers were given the priority access to the vaccines after the initial rollout, as well as currently with the booster regime. If you're older, you're already more vulnerable due to your age. And if you're in a position to receive care at that age, the risk is even greater. And that's the environment that we are part of, and that's the community of our loved ones or our older relatives community now or in future. And so yes, so we really do have a professional duty to work towards protecting the communities that we're part of. At the end of the day, the REC's key message is clear. Vaccines are important for all social care workers, regardless of the employment tenure. So whether you're an agency worker or employed permanently, please do roll up your sleeves, literally, and get your vaccines. It's safe and it saves lives. Next slide, please. On this slide, I wanted to share some findings from a survey we did with healthcare members back in October last year. Obviously, a lot have changed since then. the government is now reviewing the mandatory vaccine regime. And the survey was carried out shortly after the department had announced a consultation for mandatory vaccine for NHS staff. So the topic was based on what was current back then, but still it's about vaccines, and the participants were a mix of businesses who work at NHS Trust, local authority, and care homes. So as you can see, our members actually agree with the vaccines as a condition of deployment, recognizing the importance and effectiveness of vaccines. However, the biggest concern from our member side was the labor shortages, which I think many attendees might also echo. Yeah, also the biggest ask from the agency side of the government when it comes to vaccine, yeah, it really came down to having that clear guidance, as well as enough time to implement changes when there's a shift in legislation. But clearly the message here is really highlighting that the most agency had agreed that our sector workers should be required to be fully vaccinated. And had we asked the question whether they think healthcare workers should be vaccinated, not in relation to legislation, the percentage of yes would have been very high. Next slide, please. So yeah, I'm going to talk about a couple of examples of initiatives that our members, who are social care recruitment businesses, have taken, and what they found effective when tackling vaccines hesitancy. So many agencies found external official source quite effective. So that involved a lot of signposting. So agencies directed their workers to scientific information where workers can look at the facts and data about vaccines themselves from a trustworthy source. So and with that being said, the message from the agency should also be about encouraging vaccines take-up, and there has to be a consistent and cohesive message throughout the organization. So it's a good idea to agree on the business's clear position and messaging across the executive team or people on the ground. And our members really found effective having conversation with the colleagues. So bringing together unvaccinated workers and vaccinated workers together, where the vaccinated worker can share their very personal, just hands-on experience about the vaccine. So from their initial view to how they decide to take up the vaccine and their honest opinion, experience, and even side effects. NHS and the department have done fantastic job campaigning and experience sharing. But when it comes from someone you personally know and personally trust, and also someone in the same position, it really goes a long way and really amplifies the message. And that can be done at a range of scales, from one-to-one meetings, a small group webinar or workshops. Some of our agencies, some of our members have even carried out a full-scale internal campaign where they would share videos of vaccinated workers sharing the experience and encouraging others to come forward for vaccines. And this can and should, of course, be a two-way communication, and the unvaccinated workers should be able to ask any questions and get their concern cleared, which will hopefully give them greater confidence towards vaccine at the end of it. So I think these kind of conversations are happening organically and naturally anyways in many settings, but it does go further when agencies can put some resource into facilitating these conversations for their workers. And lastly, give them plenty of supports, not just with information and meetings, but some people will need time off from work due to side effects or to manage their anxieties. So be patient with them, give them the time they need, and support them throughout the period. Next slide, please. So the actions that individuals could take are pretty much in line with the previous slide, but on the other side of things, if you're unsure about the vaccine, find a trustworthy information source and avoid misinformation. Check your sources and only trust the official data. If you have questions about hands-on experience or have any concerns about side effects, make sure to get your questions answered and get your concerns clear. Ask a vaccinated colleague about their experiences. I fully understand and appreciate the reservation you might have. I thought about side effects ahead of all my 3 doses, but it was seeing people around me, my family and friends, coming forward for vaccine, and seeing them feeling better about living with COVID. Yeah, that really encouraged me. And luckily, I didn't really suffer from side effects, and yeah, I was even able to make it to the gym next day on all 3 occasions. So, however small your question may seem, talk to someone you trust and just be honest and open about things with them. And there'll be plenty of people who can share their experiences and help you make an informed decision. Next slide, please. Yes, so I'm coming into my end of my presentation, but I think it really comes down to 2 words, information and conversations. To elaborate a little bit, the external and independent information and conversations with someone you know and trust. So yes, I really hope, I provided some confidence and practical things that you can do around vaccine hesitancy. I'm happy to, if anyone have any questions, I'm happy to have a follow-up conversation. So do make a note of my email, and thank you for your time. That's it for now from me. Yeah, back to you, David.
Thank you very much, Yerin, for a really practical, informative and detailed presentation. I thought that was extraordinarily helpful, so thank you. We've got some questions coming in now for our session in a bit, so that's great. Thank you very much. Just one thing on the questions before I move on to talk about data. Amanda, you've helpfully put in a question about what are the reasons for the decline of 8% since December 2021. We're slightly scratching our heads here to understand what you meant. So if in the question section you could just explain what you're referring to, that would help us answer your question, which just shows that we are keeping an eye on them and preparing ourselves for the answers. So and actually, funnily enough, that leads nicely on to what I wanted to talk about now briefly, which is the importance of data and information and making sure that everybody knows what the position is. And one of the things that led to the formation of the Vaccine Boosters Task Force that I am chairing is that there is and has been concern about the level of booster vaccinations for social care staff in different settings, whether it be in care homes, home care, or indeed the many personal assistants who support people up and down the country. And one of the way in which we collect this information in a very diverse sector, as you will know, where we've got about over 16,000 organisations providing social care in over 38,000 settings, is through something called the capacity tracker that all organisations fill in and keep updated on many of the evidence about how we are doing in relation to the pandemic. And this provides information about staffing levels or outbreaks, as well as things like vaccination levels. So what this gives the national organisations is and ministers is the oversight of how is the sector doing, how well protected is the sector, how well is the sector coping with this enormous challenge. And in fact, you know, in many ways, the sector has done remarkable and extraordinary things in the face of extraordinary challenges. So well done to all of you and your staff for your contribution to that. So through the capacity tracker, that is the way that it's recorded, because although there is a recording of people having a vaccination at the point of care, and indeed the point where they get their vaccination, and it does describe whether somebody's a or a social care worker, it clearly, what it can't easily do is identify which particular employer or which people are linked to, whereas the capacity tracker does, so that we can support where necessary. And this information has been crucially important in, for example, attracting resources to support the sector, which arose partly out of my task force and the winter plans. Several £billion worth of PPE and workforce grant, infection prevention control grant. So it does make a difference to what government does and how it reacts to support the sector. So it's terribly important. And at the moment, for example, the rates of vaccination boosters of directly employed staff in care homes for older people, I'm just picking that as an example. We could go through all the evidence around home care and younger adults care homes, is around about 54%, something in the region of that. This is not this is published data, but this particular bit might be slightly updated. But for agency workers, it shows a vaccination booster rate of about 17%. So clearly that is very low. And I was talking to Yerin before the webinar and saying, you know, it's probably not accurate. It's probably not right, and therefore it gives a false impression of the number of agency workers that have actually been boosted. So that shows the real importance of this data being inputted by providers, and it falls to the people who are running the service and whether agency staff are vaccinated, and it's used for oversight in the way that I've described, and it shows about 30 percentage points lower than for directly employed staff. So to ensure this data is accurate, obviously providers need to know what the vaccination status of each agency worker deployed in their service is, and of course that is only by way of people from the agencies telling the providers that that is the case, being willing to share that information. And we realise this is personal medical information. Can be a degree of sensitivity about it, but it's anonymised when it's reported to the government and to the national organisations such as the NHS. So we really, really need your support, and on top of what you've already done, to help make sure that the capacity tracker is up to date, and obviously with the consent of your workers and in line with GDPR provisions, that is proactively shared with providers so that they can input it. So there's a bit of a plea from me about that, and I'm just asking you whatever support, help and encouragement you can provide, as well, if you're an agency worker or you are running an agency, whichever position you are in. Okay, so we have now time, about 22 minutes for questions and answers, and thank you very much for your questions so far. And we've had a couple in advance, and we'll take those, and then I'll take some that are actually have been given on during the course of this meeting so far. And the first one is, as a home care provider, what guarantees do we have that government will provide consistent leadership and direction on vaccinations, testing, use of PPE and so on going forward? And I'm going to ask both Adrian and Yerin to comment on this in a minute, but I'm going to just have a little go myself at setting that out. So I think one of the challenges of the pandemic is that none of us in living memory had experienced anything like this. And when I was called upon to lead the government task force on it in June 2020, when the impact on the social care sector had been demonstrated, both in policy terms and in terms of the resources that need to be put in place, and having those resources in place, like PPE and testing capacity and so on, had to be built up to a scale that was commensurate with the challenge that was faced, which was enormous, not only in this country but across the world. And if you look at a site called the International Long-Term Policy Network for Social Care, which is run by a whole range of research organisations across the world, and the London School of Economics are critical in this country, you can see all the evidence of all the challenges that social care organisations across the world faced in relation to this. Which isn't an excuse, it's just a fact that that was the challenge. And indeed, scientifically, our understanding of the virus was changing all the time, and most significantly in the early days around the degree to which people who were asymptomatic could have the virus and transmit it, which wasn't previously understood or known. And those research on that came through in the spring of 2020. And then, of course, the variants change. So in that sense, because things change quite significantly, of course, the policy and our response needs to change quite significantly, and sometimes quite quickly, which is very difficult for service providers to manage, whether they be in social care or health, or indeed in the wider business and public service community. So in terms of direction on vaccinations, testing, use of PPE, my own task force published a report in September 2020, which set out all of the recommendations in relation to those provisions that are referred to, all of which have been consistently maintained since then. They're all under review in the context of the policy of living with COVID, but it is clear that we still have a clear and present danger, and therefore a lot of these measures are, this is to be confirmed, but there will need to be some continuing level of support, protection and surveillance in order to make sure that the service is as safe as possible, whilst of course we all get on with living our lives, including people who use social care services, as far as possible. So that's my initial reaction to that. I just want to ask Yerin if there's anything you would like to add, and then Adrian to that. You're muted.
Yeah, of course, that was bound to happen. I mean, to be honest, yeah, I'm keen to hear from Adrian first. I think as a chair body for a sector, I think it's a bit more appropriate to hear the answers.
Okay, fine. Adrian, over to you.
No, thanks, David and Yerin. What I would say is actually, and actually just before David commented on the task force and the work that he started off in September 2020, David, you might remember we also held a clinical summit at that point, and what people said to us at that clinic, so this was just after the height of the first wave of the pandemic, it was where people, I think understandably, had so many policy changes to be considering, and a lot of it was very new to them, and they wanted some simplification to be able to move forward. And I think we've had that kind of simplification through the last year or so, to be able to live and make sure that we can be as safe as possible. But we've also had the legislation around that. I think in this next phase of living with COVID, I think we are going to be moving to thinking about that legislation, those legislation changes. But for me, as a clinician, as a doctor, it's my responsibility to myself and to my patients to be able to do as much to protect myself and to protect them. And as a professional responsibility, that's how I see it. And I think we will be moving to a a phase in this pandemic where we're living with COVID, but as professionals, we are taking the right responsibility to be using the equipment that we have to protect ourselves and to protect others against COVID. As I said before, we've still got 300 or 400 people in hospital in ITU departments with COVID, so it's a serious condition, and as a GP I would want to protect myself and patients, no matter what the legislation says, over the coming months, to be able to live with COVID and to be able to get on with all the work that needs to happen in the NHS. So I hope that's my response. It's about the professional nature, and I think home care staff, as I said before, are so important to people that it's really my friend Andrew a number of years ago died with a neurological condition, but the most important person to him was the carer that went into his home, especially at the end of his days. She was a young carer, she was a fantastic carer, and if she was here today looking after him, I'm sure she would be doing the right thing to protect him and herself from COVID. So I think that is thinking about the next phase being that professional responsibility to be doing as much as you can to protect the people that you're looking after.
Thank you very much, Adrian. Thank you. Erin, do you want to say anything on that?
Yeah, so if I can come in,
Yes,
yeah, I echo Adrian's points, and I obviously talk to our members who are agencies regularly, and they all say similar things. When the vaccines were first rolled out, their workers were quite, vast majority of their workers were quite excited about it, and they couldn't wait for their time to be vaccinated. And it really truly is a small minority of portion of people who had hesitancies or haven't been vaccinated. Yeah, but I can't stress enough that it's a very tiny portion. But many workers, of course, they're passionate about their job, and came for as soon as they could about the vaccines. And yeah, as I mentioned during my presentations, agencies have also done a range of things to work with that small minority of people. Anecdotally, members have said they, in many cases, they were successfully, had the conversation to persuade and convince their workers into the correct information about vaccines. And also from the sector point of view, what our members and agency repeatedly ask and always ask is a clear guidance from the government when there's a policy change, and as well as the heads up, enough time to digest the information, come up with a plan and communicate that to within the organization and to their workers. So yeah, also for agency, a lot of it is about process and the onboarding process and who needs to check what, and also where the responsibility lies between the hirers and agencies. So yeah, I wanted to add that from the REC and sector's point of view.
Thank you, Erin. And so I'm now going to take a couple of questions from Amanda and Laura. And the first one is, when are the boosters scheduled for, please? When will frontline workers receive a booster after a primary and a booster? And the second one from Laura, will the next boosters be mandatory? So on the first, and Adrian might want to chip in here, but as far as what we described was that JCVI and the government already agreed that there needs to be a booster in the spring, i.e. not long now, for people over 75 and those who are immunosuppressed, as I said earlier, and then which wouldn't, as I understand it, be for frontline workers, but that we are anticipating that JCVI will be considering a further booster for vulnerable people in the autumn, which would more likely include health and care staff. So that's what I said earlier, and I think that is the position, although not not confirmed. On the will the next boosters be mandatory, as I described, there was a review of the position. As you know, the vaccination and condition of deployment had been implemented for care homes in the social care sector, and there was a move towards introducing it for the rest of the social care sector and the NHS. And then in the light of Omicron and the issues in relation to that, and some of the issues about the staffing levels, there has recently been a consultation for revoking that, which has just finished. So it hasn't been concluded yet. And as far as the future is concerned, I think it's impossible for us to say it categorically won't be. The government won't reconsider vaccination as a condition of deployment in the future, although the clear signal from the last few weeks has been that the government are not seeking to implement it now, and would like to try and ensure that as far as possible people are protected through a mixture of encouragement, education, enablement and support, so that if there are practical or information concerns, that they are addressed, so that people come forward to have their vaccination and boosters and so on. The other thing so that I think is that is the position. So I think the position at the moment is the government are looking to revoke it. We can't absolutely be certain about what the future will hold about this, because, as I said earlier, the last 2 years has been a roller coaster for us all, hasn't it, in terms of what we've learned and how we've had to adapt and change accordingly. And I suppose the other thing I should have said about the question from Amanda is that obviously at the moment you have a vaccination doses 1 and 2, and then you have a booster, and then we're talking about boosters on top of that. Now, Adrian, you might want to talk about that sequence of boosters and what you know about how that might play out. So I'll hand over to you.
Thank you, David. Well, I think what we know around vaccination in general is that we have a primary course of vaccination. So that primary course is around kind of getting the vaccination, and vaccination is to get your antibody response up and get your body primed to be able to combat the virus which you come into contact with. And we know that that usually is a schedule which would need 2 vaccinations to be able to get yourself up. We also know that with some people, their immune system wanes after a period of time, and so is not as effective. And we know that that's the case for older people, the group that I'm specifically interested in within NHS England. So we know that older people's immune systems might wane. We know that other people, like those who have immunosuppression and sometimes who are on drugs or particular types of therapies, might also be in that group where their immune system wanes, which is why we need sometimes to be able to deliver booster vaccinations to top up their immune system. Now, the vaccination program for COVID has been rolled out in record time, and as I say, 14 months. So we're still learning a lot about the vaccination. We're learning a lot about how long that immunity lasts. We think it does last, and it really does protect. As I said before, we think we've saved nearly 1 million people getting hospitalized due to the vaccination program. So actually there's a real life study, if you like, of what's happening and how people's immune systems react to the vaccine. But I think the new announcement by JCVI is that people who've been vaccinated, I think, and if you think about it, with the booster vaccine that we've just gone through, that really started at the end of last year, 6 months following that. So those most vulnerable people would have been starting to be vaccinated with their boosters then. They will be eligible now, the over 75s, as you said, David, for that second dose, that second booster in March. So that's, you know, next month. So we've got to prepare ourselves to do that. For the rest of the population, we've also got to think about when they can be boosted. And I think that information is going to come, as you said, with a bit of time, but it probably be later than, you know, 6 months, but we need to know it. Now, if you look at flu vaccination, for example, we have that as a yearly vaccination schedule. So we're going to possibly need vaccination in the autumn time for more of the population. But it's very much at the moment guided by what JCVI are considering, and they consider the evidence, and the NHS kind of delivers the programme according to that evidence. And they've helped us through this pandemic in terms of thinking about the prioritisation, the age ranges and other people with other conditions. And I think we'll continue to trust in terms of what they tell us about booster vaccination. Thank you, David.
Sure, thank you. And Adrian is multitasking today. He's in several different webinars almost at once, so I know he's got to drop off. But in case I don't get the chance, thank you so much for your contribution this morning, Adrian. Okay, so we've got just a few minutes left, and what I was going to do was to just take a couple of questions, and one on which I'm going to ask you, Jeroen, if you would have a go at, please, on trustworthy independent information. And your presentation was so rich with information, I thought you'd be a good person to ask that. But before I do, I just wanted to acknowledge Guy's comment about the decision for mandatory vaccination at least gave everybody a clear message about the importance of vaccinations. The tractions led to some confusion and could now give the impressions to all staff that they don't really need to bother. I fear we will have a reduction in staff taking up vaccinations in future, including booster vaccinations. Are we going to get a consistent government approach going forward? I wonder what your thoughts are. To an extent, I've answered this, and I think because I mean, one of the things that's tricky about managing and leading all of this is the nature of the risk, and the situation changes. So of course policy changes in response to it, and it appears like a consistency, but of course it's about reviewing as we go along what the justification is for any particular measure, particularly when we are inhibiting people's freedoms, and so those things have to be taken in balance, and frankly they're difficult calls, I think. But your point about the confusion and the potential message that gives, I take completely, and that's why I think it's so important that we are all equipped, both as staff and as leaders and managements of organisations, with the evidence about how important this is, because that's the communication is a huge issue in building that confidence. And Jeroen in her presentation talked about the measures that are available to that. And before I just hand over to Jeroen, I will say there is a body of information that the department and the government has available, which is available on a particular website. And maybe I could ask a colleague to stick that, if they all haven't already, they might have done, stick that link into the chat and the questions so that people can see it. But Jeroen, just a couple of points from you, if that's okay. On
I actually also did share a couple of links in the chat, the information sources, but I'll have a proper look after this and share more links to Sarah maybe, but it's mostly across NHS Trust or academia. I also saw questions about the data and reports, if I saw it correctly. So to be honest, the full report is members only, but I can share the links to the press release for each report, which has all the top lines. And to be honest, just drop me an email. I lost the question, but I'll be able to send you the full report. Yes, was there any other question that I?
Well, while you're thinking about that, I'm just going into the question. So I just say that as far as the likely to be a combined vaccine, flu and COVID, as flu take-up has been very low, the intention this time round with the booster was that people could have the flu vaccine and the COVID vaccine at the same time. In fact, I personally did. So that was quite possible, and therefore that's a proof of concept that has actually been in place. So clearly we're talking at the moment about this current booster. So if you know of anybody, or you are somebody who hasn't had it, it's not, we talked about scheduling, it's not too late at all. Please do come forward and encourage others to do so. Yerin, anything else you wanted to?
Yeah, so I found Susan's question about survey, about the reason behind the opinions of agencies for the mandatory vaccines when they are also concerned about labor shortages at the same time. I think it kind of goes back to the sense of duty, as people working in this sector, and also as members of the public. We want to protect the vulnerable people. We want to protect the community that we work in. I think that's why members, most of members, agree with the mandatory vaccines. But as a business, and also as a business working in the sector, we do have to worry about the supply and demand of the workers, which is obviously fundamental to what we do. And yes, the labor shortage is actually a very big topic for our sector. So I think that's where their logic came from. Yeah, and I know we are right at noon, so I just wanted to
sure.
Yeah.
So that's great, Yerin. Thank you so much. And I'm conscious that we've run out of time. And just to say, Noel, in terms of vaccination, no, there isn't a cost. Obviously, people have got to get there. And the government has hitherto made some money available for providers to support people in transporting to venues to get their vaccine if they should need to. So that would be in discussion with the particular provider that they're hosted by at the time. But thank you very much indeed for your attendance. Thank you very much, Yerin, for your fantastic presentation, and Adrian as well. And I hope that in some small way this has helped to clear up any issues that you were concerned about, or things that you didn't know about previous to this. We have had 24 questions. We've done our best to answer as many as we can, but we will go through them and come up with answers to ones that we haven't yet been able to address. One issue I would say is that there is a review of all the guidance around testing, PPE, vaccination, not vaccination, but testing PPE, and all the other provisions in the sector, which will be announced shortly. So the plan is to sort of get arrangements in place that alongside the revision of the overall country stance in response to Omicron. So, but in the meantime, thank you very much for all that you and your organisations and colleagues have done in supporting people with social care needs, and also all the work that's taking place in these extraordinarily difficult circumstances. And finally, thank you so much for attending this webinar, and I hope you have a good rest of the day. Thank you.